Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
According to the new ACR and Euler criteria for classification of SLE, we have new criteria, that is constitutional domain. In the constitutional domain, fever is given 2 points, and then we have cutaneous domain. In the cutaneous domain, non-scarring alopecia is given 2 points, oral ulcers are given 2 points, subacute cutaneous and discoid lupus is given 4 points, acute cutaneous lupus is given 6 points, whereas arthritis domain, in the arthritis domain, if the patient has synovitis, then 6 points are given. For synovitis, the synovitis should be present for at least 2 joints, or there can be tenderness should be present, and it should be present for at least 2 joints. Then it is 6 points are given. In the neurological domain, if the patient has delirium, then 2 points are given. If the patient has psychosis, 3 points are given. If the patient has seizures, 5 points are given. Then we have serositis domain. In the serositis domain, if the patient has pleural or pericardial effusion, 5 points are given. If the patient has acute pericarditis, then 6 points are given. If the patient has hematological disorders, that like leukopenia, 3 points are given. If the patient has thrombocytopenia, 4 points are given. Autoimmune hemolysis, 4 points are given. In the renal domain, if the patient has proteinuria of more than 0.5 gram per 24 hours, 4 points are given. If the patient has class 2 or class 5 lupus nephritis, then 8 points are given. If the patient has class 3 or class 4 lupus nephritis, 10 points are given. Then we also, these are clinical domains. So clinical domains contains constitutional symptoms, cutaneous domain, arthritis domain, neuritis domain, serositis, hematological domain, and renal domain. And we also have immunological domains. In the immunological domains, if there are antiphospholipid antibodies are present, then that is anti-cardiolipin antibody IgG more than 40, or if anti-beta 2 glycoprotein IgG is more than 40 units, then 2 points are given. Then in complement protein domains, if there are low C3 and low C4, 3 points are given. If there are low C3 and low C4, if there is either low C3 or low C4, that is either one of them is positive, then 3 points are given. If there are both low C3 and low C4 are present, then 4 points are given. Then in highly specific antibody domains, in anti-double stranded DNA antibody, 6 points are given. In anti-Smith antibody, 6 points are given.
thank you and thank you for watching.